Oh, okay. So I didn't realize we were right back at the beginning.
I think you can resume.
Give me
Yeah,
a
you might.
second. Let's see if I can skip ahead. There we go. Am I in the right place? Emma, can you give me a thumbs up if that's
Yes. Yes.
right? Perfect. Okay. Thank you for bearing with me. Good afternoon, everyone. Thank you for those of you that are sticking around for this final session. I don't think I actually introduced myself earlier when I was doing my first presentation around the CYP findings. But my name's Alison Worden and I'm a project manager with the NHS Benchmarking Network for those of you who haven't met me before. I'm taking the opportunity here for this last session just to focus on the findings around neurodiversity services across both our children and young people's mental health and adults and older people's benchmarking findings this year. This is the second year that we have really had a focus on neurodiversity services and brought those out as separate service lines to collect data on. So that's really positive that we have that kind of granularity now that we can look at these services individually. So without further ado, I'm going to start with children and young people first. So in terms of service provision, 50% of respondents indicated that they had an ASD service. I will just clarify the percentage refers to the number of submissions that said yes, that they did, as a percentage of the total who said yes or no. So not every responding service answered the question. So just to make that clear what that percentage refers to. So within England, 53% of so that was 26 services said yes, they did have an ASD team. Of our Scottish participants, one said that they did, and in Wales that was two. ADHD services, slightly less, so 42% overall across the UK participants, with 20 English providers saying yes, or submissions, I should say. 20 submissions from English providers saying yes, one from Scotland and two from Wales. And then we also have an other neurodiversity team type across adults and children. This, similar to our other specialist services in mental health, as we were discussing earlier, this can be various different things. We do ask a narrative question and we ask that providers explain what that service is, but this is sort of a catch-all for anything that doesn't fit clearly into an ASD or ADHD team. It can include combined ASD ADHD teams as well. So for other neurodiversity teams, 52% of providers who answered the question said that they did have an other neurodiversity service. This was 25 submissions in England, two from Scotland and two from Wales. So that just gives you a bit of a context of the scale of these services. In children and young people's services, we ask the teams, does this team offer diagnosis only, post-diagnostic support only, or both? Because that varies, as you can see on these pie charts, quite significantly. So for ASD services, 15 submissions responded to this question. So the participation, the complete data completeness in these questions isn't as high as it could be, with not all services actually responding to it. But from the 15 that did, 47% said that they were a diagnosis only service, with 53% saying that they offered both diagnosis and post-diagnostic support. For ADHD teams, 14% said that they offered post-diagnostic support only, and 86% said that they offered both diagnosis and post-diagnostic support. So there was actually none of the ADHD teams responding that they only offered diagnosis. And then of the other neurodiversity team types, 15 were diagnosis only, 8% were post-diagnostic support only, but the vast majority at 77% doing both diagnosis and post-diagnostic support. So really variable on that metric across the three different service types, but across all three, not great data completeness in terms of the number of services compared to the previous slide where we had quite high number of services saying that they did have that team type not completing this question. We then go on to ask, for those that do offer post-diagnostic support, a further question of, is this medication only or are there other interventions on offer, or both? So similarly, multiple choice of three. So for ASD teams, 8 submissions answered this question. 63% said that they only offered other interventions, and 38% said that they offered medication and other interventions. So there was no teams only offering medication for ASD. Whereas in ADHD teams, 36% said that they were offering medication alone in terms of their post-diagnostic support. The other kind of 2/3, roughly 64%, were offering medication along with other interventions. And then finally, for our other neurodiversity team type, 10% were offering medication only, 20% were offering other interventions, and 70% were offering medication and other interventions. So again, very, very variable here across the different service types. Looking at patient demographics, so we have shown this already as part of the wider children and young people's findings earlier today, but specifically in neurodiversity teams, we see that there is quite an ethnically diverse mix of children and young people accessing support, especially in ASD teams. However, there is still quite a notable proportion where the ethnicity is unknown or not recorded. So that's 12% in ASD teams, 16% in ADHD teams, and 19% in other neurodiversity teams. And we'd really emphasise that it's really important that that data is completed and that ethnicity is recorded, as without that it is hard to accurately assess if there is gaps in access and gaps in support in accessing support for these conditions. In terms of gender, all three team types were predominantly male children, young people accessing those services. So in ASD teams, that was a 60-40 split. So 3 in 5 patients on caseload were male and 2 in 5 were female. For ADHD, this is even further, so 70% to roughly 30%. And then for other neurodiversity teams, this was 64% male and 35% female in terms of the patients on caseload. So this may indicate a bit of an access gap in terms of female children and young people being able to access diagnosis and support for neurodiverse conditions. I'm going to now look at the team types one by one in terms of a bit of a summary of their activity. So for ASD teams, first of all, there were a median of 830 referrals received per 100,000 population. The team type had a median of 82% of referrals accepted. There was a totality of around 43,000 children and young people waiting for a first appointment across all of our participants this year. So yeah, 43,000 waiting for a first appointment with an ASD team. The conversion rate, which is those who had a first appointment who then went on to have a second appointment, was 69%. There were then an additional around 18,500 children and young people waiting for a second appointment, so just under half of how many were waiting for a first appointment. And collectively, then there were a median average of 193 children and young people on caseload per 100,000 population. So that's kind of the full pathway in terms of access. The chart to the side shows the waiting times. So what that is the darker orange is the median waiting time from referral to first appointment by provider. So each of those bars is an individual submission. And then the paler colour is the waiting time from first appointment to second appointment. So the eventual height of the bar is the wait from referral to second appointment. So as is written on the slide there, the median waiting time from referral to first appointment was 42 weeks, with a slightly higher referral to second appointment of 43 weeks. And just for context, in a general children and young people's mental health team, the median waiting time is 4 weeks for first appointment and 10 weeks to a second appointment. So that really shows there the vastly different waiting times in ASD services. Okay, we'll talk about ADHD teams next. So there were 881 median referrals received per 100,000 population. This team had a very high referral acceptance rate of 94%. There were around 31,000 children and young people waiting for their first appointment as of the 31st of March. This team type had a 65% conversion rate. So again, that is the children and young people who had a first appointment who then went on to have a subsequent second appointment. And there were an additional 11.2 thousand children and young people waiting for a second appointment as of 31st of March. Overall, there was a median of 449 children and young people on the caseload per 100,000 population. Looking at the waiting times again, the median referral to first appointment waiting time was 23 weeks, and referral to second appointment was 38 weeks. So unlike the ASD teams where the wait to first and second were very similar, there was actually quite a big difference in the wait to first and second for ADHD teams. Again, looking at this in the context of a 4-week wait for initial appointment in a general CYP team. And then other neurodiversity teams, again, this is a little bit of a catch-all. There can be quite a bit of variation in what these teams are actually doing, but there were an average of 1,249 referrals received per 100,000 population. There was a median 83% referral acceptance rate. Overall, there were 60,000 children and young people waiting for a first appointment with an other neurodiversity team as of the 31st of March. 63% conversion rate, and then an additional 20,000 children and young people waiting for a second appointment, so 80,000 on the waiting list altogether. There were 579 children and young people on caseload per 100,000 population as a median for other neurodiversity teams. And then finally, in terms of waiting times, the median wait from referral to first appointment was 52 weeks, so 1 year, and referral to second was 58 weeks, so an additional 6 weeks on top. Then the final slide for children and young people, children and young people's services is treatment intensity. So as I said earlier, for those of you who saw me present a similar slide for the other children and young people's services, this is worked out as kind of how many contacts on average did children and young people have in the time that they were on caseload. So for ASD services, children and young people received an average of 6 contacts before discharge. They were on caseload for an average of 81 weeks. So that gives an approximate contacts per week of 0.07. For ADHD teams, this actually works out at the same, with a median of 7.5 contacts received before discharge over 109 weeks. And then finally, for other neurodiversity services, an average of 5 contacts received over 93 weeks, which gives an average of 0.05 contacts per week. Okay, so I'm now going to move on to the neurodiversity services findings for adults and older people. So 63% of participants reported an ASD service. That was 23 submissions in England saying that they did, 3 Scottish submissions and 4 submissions from Wales saying that they had an ASD service. For ADHD, that was 65%, so just a little bit higher. That was 28 submissions from England saying that they did, 3 submissions from Scotland and 2 submissions from Wales, 40%, saying that they had an ADHD service. The prevalence of other neurodiversity services was much less in adults than it was for children and young people, which was interesting. There was far, far fewer services reporting neurodiversity services outside of ASD and ADHD teams, which was an interesting divergence from the picture in children and young people's services. So again, looking at demographics, even more stark in adult services was the rate of patients on caseload whose ethnicity was unknown or not recorded. And again, just to highlight that this is so important in order to be able to see the access from patients from different backgrounds, and if there is barriers to accessing services, that's really hard to tell if their ethnicity is not being accurately or completely recorded. So that is the main takeaway from that one, really, is just that the lack of information or lack of complete information makes it really hard to see what access gaps there may be in these services. In terms of gender, unlike in children's services where all 3 were predominantly male service users, this is slightly flipped the other way, although it is more equal. But there were 55% of patients on caseload for adult ASD teams were female, 51% in ADHD teams, and then other neurodiversity again was pretty equal but slightly weighted towards male service users. So that may suggest that some of those female children and young people who aren't accessing services as a child are then going on to disproportionately access services as they become adults. An activity summary for adult ASD teams. So there were 180 median referrals received per 100,000 population. There was an 80% referral acceptance rate for these services. 40,000 roughly adults were waiting for a first appointment as of the 31st of March, with an additional 16,500 waiting for a second appointment. Once they made it onto caseload, adults spent an average of 45 weeks on the caseload, and there was a median of 193 patients on caseload per 100,000 population. Again, looking at waiting times, the median referral to first appointment for adult ASD teams was 77 weeks, which is much higher than in children's services. And just to compare to a generic adult CMHT community mental health team, the average wait to first appointment for that would be 3 weeks. So very, very starkly different. Again, with the median referral to second appointment, that was 92 weeks, so even longer, almost getting towards 2 years. And again, in a generic CMHT, the average wait to second appointment was just 7 weeks. So very, very different service there. Adult ADHD teams, there were a median of 377 referrals received per 100,000 population, with an 86% referral acceptance rate. there were 139.4, so around 140,000 adults waiting for a first appointment as of the 31st of March, with an additional 56,000 waiting for a second appointment. Once onto caseload, adults spent an average of 88 weeks on the caseload before being discharged, and there were an average of 449 adults on caseload per 100,000 population covered. Waiting times in ADHD services were a bit shorter than for ASD services, but still fairly long. So referral to first appointment was 61 weeks, and median wait from referral to second appointment was 91 weeks. So that second appointment very similar to the ASD second appointment, but that first appointment just a little bit shorter. And finally, looking at other neurodiversity teams for adults, there were a median of 203 referrals received per 100,000 population, with a 69% referral acceptance rate. There were 20.6 thousand adults waiting for a first appointment, with an additional 5,000 waiting for a second appointment as of the 31st of March. Once onto caseload, adults spent an average of 47 weeks on the caseload, around 11 months. And then overall, there was a median of 579 patients on caseload per 100,000 population. Again, I think the waiting times chart really highlights the how few services there were, how few other neurodiversity services there were for adults who participated compared to the children and young people, where there was a lot of teams of this type. So the medians for the wait times obviously are just that middle figure of 12 weeks to wait to first appointment and 18 weeks to the second, but that is I guess not taking into account those two services on the left that have significantly longer waiting times, because there are just 5 services of this type who reported waiting times. So that is the caveat to that. But that's the end of the neurodiversity spotlight. I'll just move on to the final slide, and I'll hand back to Emma. Thank you.
Fantastic. Thanks, Alison. It's been a packed day. I think hopefully something to take away for everyone. I haven't seen any questions around the last session in the chat, and can't see any hands up at this point. So it just remains for me to say thank you so much to everyone who has joined